Rosemary Kennedy disappears from the public eye. She disappears.
The brain dies.
Back then, they called it treatment as it got quieter.
They often used quiet.
우리는 닥터 friends.
Hi, we are Dr. Friends. Today's trending corner.
Oh, it's trending now?
It might seem like we're covering bizarre topics, but there are many. We did odd things, and recognizing common diseases is recent. We did many strange things, and this is just wow. Preparing, I found it surprisingly strange.
Were people really this daring?
Kennedy family.
Famous.
They're a famous US royal family. Do you know Rosemary Kennedy? You might not.
Heard of her?
Some might know.
John F. Kennedy's sister.
Is she famous for gossip?
There's a photo of her taken with her father, George Kennedy, at Queen Elizabeth's palace in 1938. She's incredibly beautiful. Just from that photo, she received numerous marriage proposals in America. But she had a secret. In the early 1900s, medicine hadn't advanced much. With a lack of knowledge and systems, Rosemary Kennedy was born, but the delivery was delayed. She was ready to be born but couldn't come out. A nurse advised to close her legs.
Why?
They must have believed it back then. As they closed her legs, the baby's head got stuck, leaving her cramped. So, perhaps blood didn't flow well to her head. Maybe she didn't get enough oxygen. We can't know for sure if this was the decisive cause. But we do know from various records that Rosemary had some cognitive impairments. Even as an adult, she struggled with spelling and emotions. Like when she got angry. But the Kennedys were already prestigious. Her father, Joe Kennedy, thought, couldn't they fix a daughter like this? Because at that time, faith in science was almost blind.
Back
Right?
then.
The Kennedy family had power, connections, and money.
They needed to have honor. They wanted her to be someone worthy of the Kennedy name. That's
Yeah.
when Dr. Walter Freeman approached them. He said he could fix it. He claimed he could help. In 1941, a lobotomy was done.
A lobotomy.
Yes. Rosemary Kennedy vanished from public view. It's terrible, but brain surgery isn't unusual in history. I've mentioned it in the history of headaches. They've been
Yes.
doing it for 7,000 years. Headaches were common, so surgeries decreased, but for those with mental illnesses and hallucinations, and those who screamed, surgeries were still advised. People thought they were possessed by evil spirits, so they opened the skull, and surprisingly, even after such surgeries, people were resilient. Not many died. During the Renaissance, more and more people started dying. A doctor thought just opening the skull wasn't enough due to stones or other issues, but he never acted on it. Later, during wars, they noticed people with forehead injuries became quieter and calmer, sparking more interest in the brain's role.
The frontal lobe determines a person's personality.
Right? And it's where we get the drive to act on desires. When removed, people seem calmer.
They don't do anything.
In 1888, a doctor from Switzerland called Gottlieb Burckhardt operated on 6 patients with hallucinations. It was his first attempt, so he got help. They drilled a hole in the skull and used a sharp spoon to scrape the frontal lobe, partially removing it.
What? Scraping the brain?
Yes, and the patient with schizophrenia became quiet. After the surgery, there could be brain hemorrhages.
And infectious occur too.
Yes, and there was no concept of sterilization then,
That's insane.
but when they said the patient was quiet. Oh, he's mad. How can you put a spoon in someone's head? If you want to open a head, start with yours. They reacted very sensibly,
That's a relief.
so it wasn't accepted. At that time, the term lobotomy hadn't even been coined. This person faded into history.
Makes sense.
50 years pass. But life changes a lot during this time. In the 1800s, people didn't care about the mentally ill and just neglected them. But as medicine and times advanced in the 1930s, the thought in treat them merged that built mental hospitals, and by 1940, There were 400,000 inpatients
In one.
in mental hospitals. So not just patients, but 400,000 admitted patients.
That's a lot.
The reason is that before, in rural societies, if there were mentally ill people, they somehow managed within the
Right,
community,
Jared.
in villages with extended families. But with urbanization and industrialization, it became difficult.
Wasn't possible.
Yeah, they couldn't be cared for. If someone had issues, neighbors knew and took them home.
And helped.
But as urbanization progressed, it started becoming a social issue in the US.
Without clear treatments, it was just custodial care. But it wasn't really treatment.
Just locked up.
Patients with all sorts of conditions like schizophrenia, bipolar disorder, depression, and dementia weren't even classified.
In that situation in 1935, a Portuguese doctor named Egas Moniz appeared. He was the one who completed the frontal lobotomy.
Complete what?
Excised bone near the frontal lobe.
Bone here.
Then he injected ethanol into the area near the frontal lobe. He did a chemical lobotomy, and they calmed. It felt like a solution because their desire for self-fulfillment disappeared. However, most in mainstream medicine thought, he's crazy.
How could you do that?
That was it.
How could you do that?
Initially, yes. But he gained followers due to the overwhelming number of patients.
When he did it, there were no deaths then.
Because it was injected,
Ethanol is clean and can be used aseptically.
those who had surgery then survived. So Walter Freeman, who operated on Rosemary Kennedy, he teamed up with a neurosurgeon named Bayswatz. Let's try frontal lobotomy. It wasn't only performed on mental health patients, also on prisoners who repeatedly committed crimes and kept returning to prison.
Aggressive?
They tried it out. Became quiet.
Really?
They used the expression became quiet. Became quiet. Politicians started supporting them, thinking, let's make people whom society can accept quiet and manageable.
Destroyed personality.
As they implemented it widely, they were recognized for their contributions. That Portuguese doctor, Egas Moniz, received the Nobel Prize in Medicine.
Really?
Yes. As he gained recognition, the duo gained momentum and started changing surgical methods. They wanted to avoid cutting the skull, leading to the ice pick method. No need to make a hole. Eyelid.
Eyelid.
Flip the eyelid and go underneath like this. Insert it, and with a slight poke and stir, the frontal lobe is gone. Then do the other side. Then both sides undergo lobotomy. Then the person becomes quiet. He was convinced this was the way for patients in the world. Walter Freeman carried the ice pick across the US, performing surgeries. What eventually led to its disappearance?
After Kennedy,
No, it continued after that.
did Kennedy survive or not?
They couldn't even do what they did before.
But with no alternatives, they'd have continued. Then new drugs like chlorpromazine came out.
In 1954, chlorpromazine, marketed as Thorazine, was introduced as a miracle drug.
So they stopped surgeries when the drug appeared.
Yeah, when this drug came out, it was safer and more effective than lobotomies.
That's now.
When tried,
For symptoms like hallucinations and delusions, which were tough in mental illnesses back then. Schizophrenia and manic symptoms are now a disorder where people suddenly see things, say strange things, acting very differently. It was really hard for people to deal with. Previously, insulin coma therapy.
Giving insulin to induce hypoglycemia, right?
so they would lose consciousness.
Kills the brain.
They quieted down, so it was called treatment.
They often used quiet.
But with the introduction of CPZ, chlorpromazine in psychiatry, it was like the penicillin moment. From then on, psychiatry became more systematic compared to other fields. And global pharmaceutical companies started to emerge.
From that time.
CPZ is an early drug, but it's still used today for its effectiveness.
It's still used.
Now it's used more as an auxiliary drug in smaller doses than before. It doesn't cause death, collapse, or loss of consciousness, but it makes you feel better.
Until then, it was so.
Think about it. From horrific surgery to taking a pill. The literature says with chlorpromazine, the ice pick disappeared.
Thank goodness.
It disappeared. It's a relief.
It's sad history.
Right, but medicine's history is all sad.
So many people suffered, didn't they?
They were sacrificed immensely.
Not just minorities, even the Kennedy daughter experienced it. It was so prevalent.
It was widespread and even won a Nobel Prize.
Really,
Some say it should be revoked, considering the times. Be grateful.
Be grateful indeed.
We are enjoying the benefits now. Next time, the bizarre history of medicine.
Bizarre is now attached.
So many strange things. Really seem crazy. We'll prepare more and come back. Thanks.
thank
Thanks.
you.